Hello everyone, this is Joshua Smith of Apollo's Artifacts. In this episode, we're going to be taking a look at a number of articles which bolster the point that I made in a previous video about how none of the numbers are reliable when it comes to COVID-19. And as far as that goes, it's also true of the flu. What you're going to find that they have to admit is that all of these are based upon guesstimates. They're all based upon various models, and we've seen how many times the modelers have been wrong lately. Wrong literally about every single prediction that they have made. That's why in sports there's a famous saying that's why we play the game. We don't just guesstimate and estimate or model who's going to win. We play the game to find out who's actually going to win. So the first thing that I would draw your attention to is an article from Time called "This Past Flu Season Was the Longest in 10 Years, CDC Says." This was published June 20th, 2019. And of course, as usual, I will link all of these below so that you can check them out for yourself. In the opening here it says, the 2018-19 flu season may not have been as severe as the one that came before it, but it set a record of its own, the CDC says. It was the longest in a decade, lasting 21 weeks. Fewer illnesses, hospitalizations, and deaths were reported this year than during last year's notoriously brutal flu season, earning the 2018-19 season an overall severity rating of moderate. But the length and the trajectory was unique. Come down to a very interesting paragraph here where it says, high early season vaccination rates and a relatively effective annual vaccine appeared to help suppress illnesses. In total, the CDC estimates that up to 42.9 million people got sick during the 2018-19 flu season. 647,000 people were hospitalized and 61,200 died. That's fairly on par with a typical season and well below the CDC's 2017-18 estimates of 48.8 million illnesses, 959,000 hospitalizations, and 79,400 deaths. You will note here that these figures are very comparable and even exceed those of COVID-19. And although it here does encourage people to go ahead and get the flu vaccine, I'm going to cover some articles in a later episode that draw some of that into question. Because there have been some complicated findings with the flu vaccines that show that getting them 2 years in a row actually makes a person more vulnerable to getting the flu, and just having the flu vaccine one time makes a person more vulnerable to getting other kinds of respiratory infections. These are things that people don't usually think about. Here's another article talking about the same issue in Stat from the AP, April 19th, 2019. Two-wave U.S. flu season is now the longest in a decade. 3 months ago, this flu season was shaping up to be short and mild in the U.S., but a surprising second viral wave has made it the longest in 10 years. Now, I wonder if we had called the second viral wave novel, people would have freaked out and lost their minds like they did about COVID-19. Remember, the transmissibility factors are the same for this. The protocols that you would follow are always the same. Wash your hands, don't touch your face, don't lick and suck on your fingers, don't poke them in your eyes. The same basic protocols. One of the main differences between COVID-19 and the flu, however, is that young children are typically at great risk from the flu. They do not seem to be so from COVID-19, but the elderly are, as the elderly are with almost every other kind of condition. That is typical. There's nothing surprising about it. Now, pay close attention to what they say down here. At this point in the article, it says an estimated 80,000 Americans died of flu, meaning in the previous year. The CDC is estimating that flu-related deaths this season is in the range of 35,000 to 55,000. These figures will be important later, so remember these. I'll move ahead to another article also from Stat from the AP, September 26, 2018. CDC, 80,000 people died of the flu last winter in the U.S., highest death toll in 40 years. And once again, with this incredible death toll of about 80,000 people, we also did not see the entire economy shut down, risking the United States' position in the world. We move down a bit in the article here where it says in recent years, flu-related deaths have ranged from about 12,000 to, in the worst year, 56,000. But last fall and winter, the U.S. went through one of the most severe flu seasons in recent memory. It was driven by a kind of flu that tends to put more people in the hospital and cause more deaths, particularly among young children and the elderly. It also goes on to point out, in a shocker, making a bad year worse, the flu vaccine didn't work very well. Experts nevertheless say vaccination is still worth it because it makes illnesses less severe and saves lives. But of course, all of these experts have been taught out of the same textbooks, and the textbooks are all controlled by Big Pharma. It's not very hard to figure this out when you start looking into Houghton Mifflin Company and its ties into Big Pharma. The big pharmaceutical companies dictate literally what is in and whether or not a textbook ends up being pulped entirely. That means an entire line of textbooks can be destroyed if they do not say what the big pharmaceutical companies prefer them to say. I could support all of this too. There are many articles about this. Lots of other people have already researched all that. But at the same time, I'm not advising you against getting the shot. Go ahead and do it if it's what you want to do. That's always up to you, of course. Among the other things that we see here that are really important, CDC officials do not have exact counts of how many people die from flu each year. See, this is where the estimations and the modeling comes in. Flu is so common that not all flu cases are reported, and flu is not always listed on death certificates. So the CDC uses statistical models which are periodically revised to make estimates. Fatal complications from the flu can include pneumonia, stroke, and heart attack. Now, this is one of the things that's been so confusing with COVID-19 is that people are being labeled as COVID-19 deaths when they've died of other sorts of complications that may or may not have been directly caused or exacerbated by COVID-19 itself. So you've seen a lot of people drawing this under the microscope lately. Now I'm going to move ahead to another article that points out what I said was a major problem from the beginning and is a consistent problem that runs through both flu estimates and coronavirus estimates. Headline, a fiasco in the making. As the coronavirus pandemic takes hold, we are making decisions without reliable data, says John P.A. Ioannidis, March 17, 2020. And he begins here pointing out what I have also been saying repeatedly. The current coronavirus disease, COVID-19, has been called a once-in-a-century pandemic, but it may also be a once-in-a-century evidence fiasco. At a time when everyone needs better information, from disease modelers and governments to people quarantined or just social distancing, we lack reliable evidence on how many people have been infected with SARS-CoV-2, or the Wuhan virus, whatever you want to call it, or who continue to become infected. Better information is needed to guide decisions and actions of monumental significance and to monitor their impact. Draconian countermeasures have been adopted in many countries. If the pandemic dissipates either on its own or because of these measures, short-term extreme social distancing and lockdowns may be bearable. How long, though, should measures like these be continued if the pandemic turns across the globe unabated? How can policymakers tell if they are doing more good than harm? Vaccines or affordable treatments can take many months or even years to develop and test properly. Given such timelines, the consequences of long-term lockdowns are entirely unknown. Well, I would say they're not entirely unknown. You're going to be looking at complete total devastation of the United States economy. You're going to be looking at lots of people who are homeless or starving and who are committing suicide. But he draws a fine point here on what I've been talking about. The data collected so far and how many people are infected and how the epidemic is evolving are utterly unreliable. Given the limited testing to date, some deaths and probably the vast majority of infections due to SARS-CoV-2 are being missed. We don't know if we are failing to capture infections by a factor of 3 or 300. 3 months after the outbreak emerged, most countries, including the U.S., lack the ability to test a large number of people, and no countries have reliable data on the prevalence of the virus in a representative random sample of the general population. I think they did do one of these randomized tests, though, in a town in Germany, and they came up with a figure of about 15% of people had already had it. And again, the article continues, this evidence fiasco creates tremendous uncertainty about the risk of dying from COVID-19. Reported case fatality rates, like the official 3.4% rate from the World Health Organization, cause horror and are meaningless. Patients who have been tested for SARS-CoV-2 are disproportionately those with severe symptoms and bad outcomes. As most health systems have limited testing capacity, selection bias may even worsen in the near future. So people who have almost no symptoms, there's no reason to go have a test. Why would you? And thus all those are missed, and then you're fatality rates or your mortality rates do not accurately depict what's really happening at all. He points out something here critically important. That huge range markedly affects how severe the pandemic is and what should be done. A population-wide case fatality rate of 0.05% is lower than seasonal influenza. If that is the true rate, locking down the world with potentially tremendous social and financial consequences may be totally irrational. It's like an elephant being attacked by a house cat. Frustrated and trying to avoid the cat, the elephant accidentally jumps off a cliff and dies. And that is exactly where the American economy is right now, because Trump was backed into a corner by the mainstream media, which had a hysterical panic attack about COVID-19, and he had to act. He had to do something. But also, this economy has to open back up, and it's going to have to happen in May. I think it would also be quite ironically funny to go ahead and do that on May 1st, given that date's occult implications and also the socialist and communist implications of that particular date. And we come down here and he points out even more problems with the models and the statistical guesswork that's being done. Although successful surveillance systems have long existed for influenza, the disease is confirmed by a laboratory in a tiny minority of cases. In the U.S., for example, so far this season, 1.073 million specimens have been tested, and 222,552, or 20.7%, have tested positive for influenza. In the same period, the estimated number of influenza-like illnesses is between 36 million and 51 million, with an estimated 22,000 to 55,000 flu deaths. Note the uncertainty about influenza-like illness deaths, a 2.5-fold range corresponding to tens of thousands of deaths. Every year, some of these deaths are due to influenza and some to other viruses like common cold coronaviruses. He goes on to point out here that a small percentage may be flu-related, but a higher percentage, up to 47%, can be other types of respiratory virus infections. Now, remember what I said before about how the flu vaccine sometimes makes people more vulnerable to these other types of viral flu infections. That's really important to think about. So it says here, a positive test for a coronavirus does not necessarily mean that this virus is always primarily responsible for a patient's demise. It could be all kinds or any number of other complicating factors, a series of other comorbidities that a patient already presents with. And he goes down here to point out a whole host of other problems, everything from keeping schools open or whether schools should be closed, whether herd immunity is better to pursue or trying to flatten the curve, which he says here is conceptually sound, but in theory. In other words, it seems to work well on paper, but we don't really know how things like that will turn out in the real. So far, the social distancing does seem to be working in the real, much to the chagrin of the mainstream media, which loves massive death tolls. They love putting those red letters and red numbers up there on the screen because they have a captive audience right now with millions of people who are not working. So that means, of necessity, more eyes are tuned towards the media. And if it bleeds, it leads. Now we move over to another complicating factor. This is from the Daily Wire, April 7, 2020. Dr. Burke says we have very liberal recording of COVID deaths. If they test positive, we are counting that. During Tuesday's White House press briefing, Coronavirus Task Force leader Dr. Deborah Birx explained that COVID-19 deaths in the United States have very liberal recording guidance, noting that anyone who tests positive for the virus and dies would be included in their numbers of coronavirus deaths. Do you see how this can cause lots of problems with models and statistical guesswork from so-called experts? Responding to a question from a reporter about potential underreporting of novel coronavirus deaths in the nation, Dr. Birx responded, I think in this country we're taking a very liberal approach to mortality, and I think the reporting here has been pretty straightforward over the last 5 to 6 weeks. If someone dies with COVID-19, we are counting that. So here, this goes back to my original video on this where I said, are we even working with the same definitions nation to nation on this? If you go to the Johns Hopkins website where it talks about the total number of people recovered, what is the definition of a person who has supposedly recovered from COVID-19? What about all these articles and all these reports that we've seen about people becoming infected a second time or testing positive for a second time after it has supposedly gone away once before? How are those being tallied? Of course, we can make no sense whatsoever. The numbers that come out of China, those are just basically garbage, and I can't believe that anybody takes them seriously at all. We go down here a bit further in her comment. She says there are other countries that if you have a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, she explains some countries are recording that as a kidney issue or a heart issue and not a COVID-19 death. Well, we have the opposite problem in Italy, where they were classifying everything as a COVID-19 death, regardless of all these other comorbidities or underlying problems. And here we have another article from Real Clear Politics talking about the same issue, April 8, 2020. Dr. Birx, unlike some countries, if someone dies with COVID-19, we're counting that as a COVID-19 death. But if you go over to CNN, they're calling it a right-wing conspiracy theory that this is how COVID-19 deaths are being classified on the death certificates, even though it's very plainly right here from the top expert in it. She's telling you exactly how they're being classified. Now I'm going to move over to another page. This is from the CDC itself, showing how the CDC estimates the burden of seasonal influenza in the U.S. And it talks here how it's just a series of statistical models. They don't actually know what the figures are at all. Again, it's more scientific guesswork. Scroll down here to a really important section, because we've been talking about the death certificate issue, where death certificates are being labeled as COVID-19 deaths, even though some people say, grandpa was taken in with cancer, had been dying of it for 3 months, and then it's listed as a COVID-19 death, and they're like, well, we think it was the cancer that killed grandpa. And this section says, why doesn't CDC base its seasonal flu mortality estimates only on death certificates that specifically list influenza? It points out here how sometimes these are associated with secondary complications, which could include bacterial infections. And it's the same also with COVID-19. And they even show you a visual of it here about how these are estimates in models, because they have to correct for underdetections here, which of course could be wrong, and then extrapolate to the U.S. population, which could also be wrong. So you have a whole series of leaps and jumps and logic and estimations all over the place. And finally, we'll go to this article also from Stat. It's difficult to grasp the projected deaths from COVID-19. Here's how they compare to other causes of death. And this is one that's sort of trying to pump up the hysteria around it. So they do this by saying that the lower estimated figure of 60,000 is something like Dodger Stadium being full in Los Angeles, or the number of passengers in 180 full jumbo jets, or more than the number of combat deaths in the Vietnam War. But then they jump on this figure that's 4 times higher at 240,000 and pretend as if that's going to be what ends up happening. And I don't think it's going to come anywhere remotely close to that figure. Then remember the numbers I asked you to remember before from the previous flu seasons. So they're trying to show you here that COVID-19 is somehow comparable to these other flu seasons, but this is very much problematic, because remember that the record was set with the other flu season that said it was about 80,000 deaths. Well, they choose the lowest end figure that they could possibly attach to that to make it comparable to COVID-19. Then they do the same thing over here. Remember the other death figures for 2018-19, the double wave of flu that we covered before? It was estimated 35,000 to 55,000. They go even below the lowest estimated range for that, just so they can pump up the hysteria around COVID-19 here. Then they go on to compare it to other causes of death, heart disease and cancer, but they use these graphics which make it seem as if COVID-19 is also comparable to those, with this dotted outline of an estimated upper limit. Why would they do this? But very astutely down here, a commenter points out that not shown are about 38,000 deaths from car accidents, about 15,000 killings. There were almost 170,000 accidental deaths as well. The figures for various diseases are about half of those given by the CDC, and the person links here the CDC's website, which shows that the figures used in this article are indeed problematic to the low end and also to the high end of COVID-19. This, I would say, is absolutely despicable behavior from these two authors. But it all goes to show my main point is true, which is that none of the numbers are reliable at all. So